So basically, I've suffered from chronic golfer's elbow and tennis elbow both. I had PRP injection done about 5 years ago, and this just started happening again recently. And I have weakness when I lift like even a gallon of milk, and it's even worse with pain when I go to pour the milk.
Okay, so turning motions, bringing the arm up,
and
lights it up.
Yep, right up here at the elbow, or just down from the elbow.
Okay. So all the way through here, so just palpating that like common extensor tendon that we were talking about before, like all the forearm muscles that come to extending the wrist come together to a common tendon through here. The tennis elbow you're talking about. So palpating that is very ropey.
It's like a rock.
Yes, very ropey. And tendons are ropey in general, but not like this. So you can tell it's been chronically inflamed for a while by the feel, and that's tender, I'm assuming.
Yeah, but not real bad.
Okay.
But I think what's kind of aggravated it is I've been doing hook work on the horses, my daughter's horses, and that motion of flicking the wrist to clean the hooves out with the hook has made it, I think, some worse.
And that makes sense, right? Because you're constantly putting that muscle on quick stretch.
Okay.
So it is not going to like that. So I'm just kind of outlining where some of the pain is. Just going to keep me in line there. And then through here too, it's even down into there.
Like you really have to press to make it hurt.
Okay.
I mean, it hurts
I don't
when
really want to do that, but
right. No, I understand, but it hurts when I use it, but pressing on it at rest here, you really have to press hard
to get it to
for it to hurt. So it's mostly that it's an issue with function.
Okay.
And if this can help with that.
So needling definitely is going to help get. So a lot of times when you have like tendinitis, right, you get a lot of like calcification in the area, and the tendons don't always have the best blood flow. So this is going to make blood flow go there a little bit more because of scratch that the needle makes on the muscle, right?
Okay.
The body's going to sense that, and then it's going to send more blood, which means more oxygen, more nutrients to the area, which is going to help that tendon. And then this needling can also help like the body release more endorphins, which is like our natural like pain relieving substance in the body.
You're in the right spot.
Yeah. I just kind of, and sometimes, so see the twitch response we just got?
Stung a little bit.
That can happen when you get into a trigger point. That twitch response, it actually is a good sign. That means we're in the right treatment area, because then we're going to get more relaxation with the twitch response. Because as you know too, right, when you get it like a tension there, you just get more acidity built up in the area. And so this is going to help break up some of that acidity and have the body like flush it out. Okay, and then I add in this. And like we talked about, like you don't have any pacemaker, loop recorder, or anything like that, so we're good to use this. So basically this just makes the needles more effective, right?
So are you completing 2 different circuits there? Or?
Yes, there's 2 different leads, 2 different circuits. So one's going to run here, one's going to run here. Depending on what I'm trying to go for, sometimes I'll cross them, and sometimes I just keep them in line. For the first session, I usually go straight down because it's usually a little more comfortable and easier to differentiate between the leads.
It's usually a little more comfortable.
Comfortable in the fact of like you can differentiate between the 2 leads. Some people, when you cross them, they can't tell. So I'm going to turn up the first lead, which will be the red lead. Sometimes you get a little muscle contraction with it, and that's okay. That's actually a good thing. Sometimes you don't. So I'm going to go slow, because sometimes it goes quick.
Yeah, I can feel a little tingling in my hand.
Okay.
Along the medial edge in the anatomic position.
Okay. Sometimes it will be like a tapping sensation too. So let me know. We want it strong, right?
I can just feel that tap, tap, tap.
Okay. Go up a little bit more. And so we're starting to actually get a little contraction there, which is good. Okay, and I'm going to turn up the other one before we go anymore, just because we were getting a contraction. There we go. Now we're going to even a little more. Doing okay still?
Yeah.
Cool. Okay, good. Now the other side's going.
Yeah.
Good. And then we also know we're in the right area because now your
Fingers
fingers are going too.
Yep.
So it's very mild. It's not really painful, right?
It's not. It's just like
Just a weird sensation.
a weird sensation. Yep.
But and then sometimes the muscle will do this where it starts going more. So then I just turn it down just a smidgen. So it's not quite as strong.
So how long do you typically
About 10 minutes
with the
with these in.
power hooked up
Yep.
to it?
If I don't use this, like if somebody has a pacemaker, loop recorder, things like that, I can't use this, I will keep the needles in for a little bit longer.
Okay.
And then I'll come by and I'll like twist them because then it winds the fascia around the needle more, so it just makes more of an effect. So, yeah, see, and this also tells me your muscle's very aggravated because see how it keeps
It's
revving
speeding
up
again.
and then it closes. That's a sign of a very aggravated muscle.
Yeah. Oh yeah. It's. Yeah.
How many hooves have you cleaned?
Oh, God. Well, 2 horses, eight of them a day for every day. But you know, our horses, like, they hand you the hoof for the most part. You don't have to fight them. Occasionally one will get a little hinky and they'll try and pull it back. You just don't let go. And so, but that doesn't hurt really when I'm doing that, other than